Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is our COVID-19 briefing for British Columbia for Monday, December the 7th. We are honored to be here on the territory of the Lekwungen-speaking people, the Songhees and the Esquimalt First Nations, and we're honored to be here on their territories. Tomorrow, Tuesday, we'll be providing a written report with COVID-19 case numbers and other relevant information to the COVID-19 pandemic in British Columbia. And now, it's my honor to introduce Dr. Bonnie Henry.
Thank you very much and good afternoon. So today we're reporting our weekend numbers. So the first reporting period from Friday to Saturday, we had 647 additional COVID-19 cases in British Columbia. From Saturday to Sunday, 726 cases were diagnosed, and from Sunday to today, an additional 647 people were diagnosed with COVID-19. That brings our total for the last 3 days to 2,020 new cases, 10 of whom were epidemiologically linked, bringing our total in British Columbia to 38,152 people who've been diagnosed with COVID-19. That includes 304 people in the Vancouver Coastal Health Region, 1,362 people in the Fraser Health Region, 45 people in Vancouver Island Health Region, 203 people in the Interior Health Region, and 106 people in the Northern Health Region. We now have 9,380 active cases in the province in all health authorities, of whom 349 people are in hospital, 77 of whom are in critical care or ICU. We have 10,747 people under active public health monitoring, again, in all areas of the province, and 27,287 people have recovered from COVID-19. Over this past 3 days, we've had 35 people who have died from COVID-19, bringing the total number of people in British Columbia who've died from COVID-19 to 527. This, of course, brings sadness to us all. And my condolences go out to the families, to the care providers and communities of these people who've passed away over the last 3 days. We know how challenging, how hard it is to lose somebody during this time of year, and particularly during this time of COVID. We have 6 new healthcare facility outbreaks in a variety of places around the province, including the Bradley Centre, Chilliwack Lifestyles, Crofton Manor, Lakeshore Care Centre, McKinney Place, and Village by the Station in Interior Health. In addition, outbreaks have been declared over at the Hawthorne Seniors Care Community, Lakeview Care Centre, Sunset Manor, Valley Haven Care Home, and Ridge Meadows Hospital. That leaves us with 57 active outbreaks in long-term care and assisted living and 8 in acute care units. There are now 1,697 active cases in long-term care, 1,073 residents, and 605 staff. Additionally, we've had 1 new community outbreak at a mink farm in the Fraser Health Region, and of course we are paying very close attention to this outbreak. In other parts of the world, particularly most recently in Denmark, and prior to that in the Netherlands, and as well in the US, we've seen outbreaks on animal farms such as this, particularly mink farms, where there has been transmission from humans to mink and back. And where we've seen some mutations of virus in some parts of the world. So it is of great concern for us, and we are working closely with WorkSafe BC to ensure that all of the measures on the farm are being done appropriately, and also with the Ministry of Agriculture, our animal health colleagues, to make sure that the animal security and health is maintained as well. And this is, of course, an important measure that we need to look at holistically, and we're involved with both the CFIA and the Public Health Agency of Canada to make sure that all of the appropriate measures are taken on this farm and the other farms here in British Columbia. That includes very strict controls under the Animal Health Act here in BC for who and what can come or leave on the farm. Today as well, we have some very good news about an upcoming vaccine that we can all take some heart in, as we all do our part now, knowing that the availability of vaccine to protect those people who are most at risk is actually just days away now. Next week, we expect to receive our first delivery here in BC of the Pfizer vaccine, as you heard announced federally this morning. It will be a start of a program, a very important start, but just a small amount to start with to ensure that we get our logistics going, but our ability to start protecting elders and seniors, particularly in our care homes and the healthcare workers who care for them, will be an important step forward in our COVID-19 struggle. And later this week, Dr. Ross Brown and myself and the Premier and Minister Dix will be providing a full briefing to everybody on the vaccines themselves and our approach and our team and how we're going to be managing this very complex and challenging initiative, but make sure that we have an adaptable and flexible plan so that we can get vaccines as efficiently as possible to everybody who wants them here in British Columbia. All right, I'm going to start today. While we can all celebrate this encouraging news about vaccines, we can't lose sight of the fact that we continue to have very high levels of transmission and community spread here in British Columbia. And hundreds of people, as you know, remain in hospital, and as we've seen this weekend alone, tragically, far too many people in BC have died from this virus, and many more are at risk right now. I want to share a couple of slides to provide an update on where we are and how we are progressing. What this one shows is by health authority region, the cases that we're having, so the number of people diagnosed with COVID-19 per million population. And this is, this is something that helps us understand how we're progressing over time. The rate of increase, as you can see, has been steep across the province, but most pronounced in the Fraser Health and Vancouver Health region. And very recently, particularly in the last few days, we have starting to see a leveling off. This shows that what we are doing, the measures we have put in place, are starting to have an effect and starting to work. This means that what you are doing every day is making a difference. But we are not yet through this storm, and we cannot let up now. All around us, in every community, the virus continues to circulate, and we are seeing increasing rates in communities that have not yet had many outbreaks of COVID-19 or transmission in communities, including in our interior and in the north in particular. We only need to look as well to our adjoining provinces and states to recognize that we are in a very challenging time. Across Canada and across the world, particularly in the Northern Hemisphere, we are seeing that this virus can transmit very easily and that our risk is very high, despite the measures that we have all taken to try and reduce risk. The other information I'll show you here is our case counts, what we call our 7-day average. And that is a measure that helps us smooth things out over time. And the green line at the top is our numbers of cases per day in a 7-day rolling average. So we report them every day, but it levels out those peaks and valleys that have to do with when tests are completed. What you'll also see here is that our hospitalizations, though lagging the case numbers, as we know, by several weeks, are now peaking. And we need to continue to take the measures that we've been taking to ensure that that also levels off. And as we're starting to see, the blue line on the bottom is ICU and critical care. And that, again, is a very important measure. What this tells us is that the hundreds of people that are in hospitals across the province right now are receiving the care they need in a safe way, but it is straining our system. As you know, the orders that we've had in place have been to reduce our in-person social interactions as much as possible, because we know that this virus transmits, particularly now at this time of year, and particularly when we're in close contact inside, and it transmits to those people we are closest with. As well, we want to limit our social interactions to those essential activities in our lives, like work and school and other essential services. Non-essential social interactions, so things outside of work and school, where we had some leeway in the summer when we had lower rates and lower transmission, we now need to pull back from, and that any of those interactions should be done in a very safe, low-risk manner, such as small numbers and outside. In addition, we've put in targeted measures to deal with specific higher risk activities that we've seen transmission happen, and those conditions that lead to transmission, including being inside, being in crowded places, having poor ventilation, etc. Today, I am now issuing the following orders, which are in effect immediately. I'm extending my published gatherings and events order of December 4th with respect to the controls and restrictions on people visiting other people in their residence to midnight of January 8th, 2021. As well, of course, we will continue the allowances that we have in place for people who are living alone to have one or two other visitors. I am also extending my published order of December 4th with respect to prohibiting all gatherings and events as defined in the order to midnight of January 8th, 2021. This means that all those events that we have been talking about for the past few weeks continue to be prohibited, with the exceptions as they are listed in the order. However, one addition, I am now accepting from the order drive-through and drive-in to drop off and leave events. So where we know that in some occasions we have either drive-through to look at lights where people do not get out of their cars, or to drop off, and at this time of the year we've seen things like toy drives and others. As well, we are accepting drive-in and stay events to a maximum of 50 cars, in which people must stay in their cars, and people attending these events should be only your household, and the exceptions must continue to maintain physical distancing, having entry and exit controls, and ensuring that there's no congregation or congestion, and people remain in their cars for the duration of the event. As a reminder, the other parts of the gatherings and events order that do not expire remain in effect for the foreseeable future, and that is the restrictions on adult team sports, indoor and outdoor, and the group fitness restrictions. Some of these may begin to operate once we've issued the further orders and guidelines about how to do these safely in the new context that we are living in right now. As we have published last week, child and youth sport can continue with limited activities, with specific restrictions, and of course no travel for any teams in the province. As well, work-safe safety requirements that we outlined in the past weeks must continue, and these include reviewing and updating of COVID-19 safety plans in all workplaces, daily health checks, and encouragement that whenever feasible, workers work from home. And I mentioned 2 weeks ago that we are actively working with WorkSafe BC and pulling together, particularly in the Lower Mainland, teams to enhance our inspections in these areas and to make sure that appropriate safety measures are put in place. And we are bringing some more leadership to that team, and we'll be talking about that later this week, just to say that this is an important focus right now, and each business needs to revise and review their COVID safety plans to make sure that all of the measures that are needed now, given the context we are in now. I understand that for many of us, this will mean celebrating the coming important holidays in a different and smaller way than what we may be used to. We can, though, still be festive. We can still connect with family and with friends in a safe and virtual way in many cases, and we have seen so many ways that people have done this in the past months, and we will need to continue to follow this guidance. As hard as this may be, let's remember that the sacrifices we make now will protect our loved ones and countless others throughout the province, and will keep our strained healthcare system open and functioning for all of us. We just need to look at the data I presented today to see the evidence that our efforts and our sacrifices are making a difference, and we can't let that go now, particularly when we know that things like vaccines are so close and that we will save lives by taking these measures and by staying small and staying local over the next few weeks. And will help ease the pressure as we go into the year ahead. We cannot afford to have a rebound and have increased numbers of people being sick and ending up in hospital in the next few weeks. We need to hold the line and continue to bend our curve. And I want to thank all of you out there throughout the province who are continuing to do your part, because it is making a difference. We need to continue to use all our COVID safety strategies. Staying small saves lives. Staying close to home saves lives. And these are our family, our friends, our community, our lives that we are saving. We're now, more than ever, we must stick to this, and we must support each other and be caring to each other and be kind to each other, be calm and be safe. Thank you.
Thank you very much, Dr. Henry. And first of all, I want to start by expressing my condolences, that of the Premier, that of, I think, everyone in BC, to the 35 people who passed away this weekend from COVID-19 in British Columbia. That was 17 from Friday to Saturday, 10 from Saturday to Sunday, 8 from Sunday to Monday. 23 of them lived in Fraser Health, and 2 in Interior Health, and 1 on Vancouver Island, and 9 in Vancouver Coastal Health. This is, and certainly given the orders that we're working under right now, the real challenges of those orders, a very difficult time to grieve, and we want everyone to know, all those families to know, all their friends, all their caregivers, that we see their loss and see their pain and are with them at this difficult time. I wanted to note that there are 349 people currently hospitalized with COVID-19 in British Columbia, 77 in critical care. And that is, of course, across health authorities, 193 in Fraser Health, 14 in Interior Health, 10 on Vancouver Island, 42 in Northern Health, and 89 in Vancouver Coastal Health. In terms of hospital capacities and occupancy rates at the moment, we consider this with 2 types of beds. One's our base bed, and also we add to that our surge bed capacity. So in Fraser Health, hospitals are occupied at 84.5% of base bed and 63.1% of total or grand total occupancy rate. In Interior Health, it's 89% of base bed and 70% when you add surge beds into the equation. In Northern Health, currently across Northern Health, it's 80.6% of base beds and 1.6%, I should say 57.9% of overall beds. In the Provincial Health Services Authority, it's 74.1% base bed capacity and 67.2% of base plus surge capacity. In Vancouver Coastal Health, we're at 93.1% of base bed occupancy and 68.3% when surge beds are put into the equation. And on Vancouver Island, it's 81% of base bed occupancy rate and 74.4% of total occupancy at the moment. In critical care, those numbers are similar overall across the province. It's 78% in critical care in Fraser Health of base bed occupancy and 43.9% of our grand total occupancy rate when surge beds are added into it. 74.7% in Interior Health, or 60.7% of total. 58.5% in Northern Health, or 37.5% of total. In Provincial Health Services Authority, it's 66.7% of base bed capacity, or 28.6% if we add surge capacity of critical care. In Vancouver Coastal Health, it's 86.1% of base bed critical care capacity and 58.9% of total. And on Vancouver Island, it's 51.5% of base bed capacity, and that is the same for the total. And so that gives you a sense of where we are in terms of beds. Of course, having 349 people hospitalized puts a very significant pressure on our hospitals and on our staff in those hospitals. It's not just an issue of beds, as we've said many times, but an issue of the overall pressure on our hospital system. Nonetheless, everyone is doing an extraordinary job. Last Thursday I reported, and I think we'll report when we update the numbers this week, another week of close to or over 7,000 surgeries being performed, both urgent and non-urgent surgeries, at a time of pandemic, which is an extraordinary achievement in healthcare. I want to bring an update for the period ended December 3rd, 2020 on our influenza vaccine update. As you know, BC has ordered 2,241,600 doses of influenza vaccine, with the final 130,000 doses expected this month. This is a 47% increase in the purchase from last year's campaign. 2,109,170 doses of flu vaccine have been distributed by the BC CDC to regional health authorities. And this number is a little behind schedule because it's based in part on billings, which are still to come in. But to date, at least 1,277,646 doses have been administered, with pharmacists administering 74% of those doses to date. All residents in assisted living facilities and almost all, 98%, in long-term care, have had their flu zone doses administered. And based on national and provincial surveillance, all indicators of influenza activity continue to remain exceptionally low for this time of year. Every Monday we update you on PPE sourcing, and just wanted to, you probably have the numbers in previous weeks. This most recent week, last week, since our November 30th update, we had 75,801 N95 or equivalent respirators, 680,500 surgical or procedure masks, 184,656 pieces of eye protection, 87,904,000 pairs of gloves, and 1,738,000 gowns. BC has had PPE for healthcare workers when they need it, where they need it throughout the pandemic response. As you know, it was very challenging in the early days. Long-term care and assisted living providers, including private and independent ones, are provided access to BC's supply chain. This ensures safe and adequate supply when traditional PPE vendors are still not entirely meeting needs. Ensured supply for PPE for surgical renewal and increases in health services started in May when the surgical renewal plan was restarted. PPE is now being delivered to GPs, MPs, etc. in 3-month allocations, direct and free access through a portal to ensure safe provision of in-person care as required. And we've of course established dramatically increased warehouse space for PPE. And just to put this in context, we updated people in July as to the cost of PPE. Just to say what the pre-COVID pricing was, for example, for N95 respirators or equivalent, the average unit price pre-COVID was 62 cents. COVID peak pricing, which was in April to June, was $5 to $9.24 a piece. In July, it was down to $3.19 to $6.80 a piece. And the most recent market data has the average unit price from $1.50 to $9.25 a piece. So it was 6 to 10 times the original price in British Columbia. At that time, for surgical or procedure masks, we went from 15 cents, an average unit price pre-COVID pricing, to peak pricing between 46 cents per and to $1.25 per a piece. By July 2020, that was 20 cents to 65 cents a piece, and now it's approximately the same. In 2019-20, BC spent approximately $62.5 million on PPE. For 2020-2021, and obviously that year will end next March, we are forecasting spending over $400 million on PPE for the health system and stockpile. And finally, just make one further note. and this is connected to the ongoing work that Dr. Henry, the Premier, that I, and many other people have done with faith communities. I want to announce that we've retained Robert Daum, a well-known and deeply respected Jewish scholar and facilitator, to conduct a series of discussions with faith leaders. I'll participate as available to assist in this very challenging period for faith communities and for them to inform us in our efforts. We very much appreciate Mr. Daum's participation, and we look forward to people across faiths and across denominations to take part in this effort. As Dr. Henry has said, the orders are being significantly extended to well into January, to January the 8th at midnight. The orders with respect to events and gatherings, both in-home and in the community. And that, of course, is going to make this a very different December, in early January, a very different holiday period. And I think that we just have to acknowledge for a moment the loss that is for lots of people. I think many, many people have, beyond issues of faith, with Hanukkah and Christmas and other holidays, that people have both a sense of faith and a sense of ritual around the season of the year, of celebration and of coming together of peoples. And this year, that will not be possible in the same way. But that doesn't mean that we won't be able to celebrate. We just have to create new and special memories and even perhaps build some new traditions. The orders are going to test us, they need our attention and require our action, but they'll allow us to make the very best of the season, to show our love, our caring ways, our generosity to others, and our abiding faith, if that religious or otherwise. And they'll keep us safe, too. This year, letting down over the holidays and using the skills we've been taught to stop the spread and pulling back from following the guidance we've been given to save lives will create a COVID debt in December and a daily case number bill that will come due in January at a cost we simply cannot afford. This year, we must spread good cheer without spreading COVID-19. This year, home for the holidays means staying home for the holidays to stop the spread and keep everyone safe. This year, no matter how we celebrate the holidays, the most precious gift to give is safety and good health, so that all of us can see in the new year with hope and anticipation, our foundations secured and our spirits renewed. Aujourd'hui, nous faisons le point sur le nombre de nouveaux cas pour 3 périodes de référence de 24 heures chacune, soit celle des 4 et 5 décembre, celle des 5 et 6 décembre et celle du 6 jusqu'au 7 décembre en mi-journée. Pour la première période de référence, qui s'étend jusqu'au 5 décembre, nous avons eu 647 nouveaux cas. Pour la deuxième période de référence, qui s'étend jusqu'au 6 décembre, nous avons eu 726 nouveaux cas. Au cours des dernières 24 heures, 647 nouveaux cas se sont ajoutés. Parmi l'ensemble des cas confirmés de COVID-19, 349 personnes sont actuellement hospitalisées, dont 77 en soins intensifs. Thank you very much. Merci beaucoup. We're happy to take your questions.
Thank you, Minister. As a reminder to everybody on the phone, please press star 1 to enter the queue. You are limited to 1 question and 1 follow-up only. I would also ask that you please take your phones off mute. You will not be audible until your name is called. First question today is from Marcella Bernardo, News 1130.
Thanks, Lindsay. Dr. Henry, just looking at the orders that you put out, if you could explain, with all the exposure numbers that we've had now across BC at schools, what was the reasoning behind not deciding to close schools early for winter break?
Yeah, so as you know, we have a lot of exposures, and we've been following very closely what's going on in schools. And those exposures still reflect and continue to reflect transmission in our communities. But we are not having large numbers of transmission events in schools. Those are very small, very few. We've had few outbreaks in schools, but they've been limited in numbers. So schools really are a safe place and an important place for education educators and for our students. So we did have discussions, and I talked about that earlier on, whether there was a rationale for closing schools early, extending breaks, and we discussed this with many stakeholders, and we've decided and made the decision that the downsides of it would be far greater than the safety and the protection of the education and the interaction that's needed in the schools.
Do you have a follow-up, Marcella?
It is actually involving something else for Health Minister Adrian Dix that one of my colleagues was hoping to ask you about. It's regarding an application that was sent to your office today seeking regulation of counselors and therapists from FACT BC, the Federation of Associations for Counseling and Therapists. They want the reform to fall in line that you've ordered over the summer. They want that to fall in line with other regulatory reforms. So what are your thoughts on implementing this and hopes of expediting this process?
Well, as you know, in the past year, we've been involved in a major reform of health professional colleges in BC. One of the outcomes of that reform is the reduction of the number of colleges, a significant reduction of that number, and the raising of the standard of regulation. Those reforms, which were, as you'll recall, developed by myself on a committee and unanimous report with the then Liberal health critic Norm Lutnick and the then Green Party health critic Sonia Furstenau, will do just that. They'll also make it easier over time for new professions to potentially become regulated should they meet the standard. And so I understand that this is a day of advocacy for people who support the efforts of FACT BC, and that they've been advocating for some time. There are other professions in those circumstances, and we'll be working with those professions as well. It's our expectation, working together with all parties in the legislature, that the very significant reforms, I think the most significant reforms ever done of health professional colleges in Canada, will be put in place in the spring, and the positive effects for the public in terms of transparency, raising of standards, and a reduction in the overall number of colleges will have a very positive effect, including for professions who are seeking right now professional recognition.
Next question is from Shannon Patterson, CTV.
Oh, hi, Dr. Henry. Just confirming, you are saying no Christmas dinner with anyone outside of your household, no eating at restaurants with anyone outside your household till January 8th, no travel anywhere outside your community all through the holiday season. If that's what you're saying, is that realistic? Do you think British Columbians will be on board with basically being locked down for Christmas?
This is not a lockdown, clearly, but yes, these are the restrictions that we've had in place, and it's making a difference. So this is what we need to do for each other, for our families, for our system here in BC, for the health system. This is a challenging time, I know that. And we have some provisions in there for other services that are provided, but what we're talking about is social gatherings. So yes, if you're used to having multiple family members come and go over Christmas and getting together and having those large dinners together, now you need to do it remotely. This Christmas and these holidays are going to be different, and they need to be different. But we have to recognize we're not alone in this. These are things that we need to take to protect our communities, and we across the globe are dealing with this pandemic in ways that are best. We're learning the best ways that we can, but we know that it is these social interactions, even small ones. So, I think maybe it's okay. I have 10 people over to my house, but it's not just my 10 people. It's 10 by 10 by 10 with thousands of families around this province. And so all of us have to do our bit right now, because we know that that's where this virus is transmitted, and particularly over this holiday period, we don't want to be exposing our loved ones to the virus.
Shannon, do you have a follow-up?
I do. I have a follow-up on behalf of a colleague about that vaccine news that is good news today. How many doses of the vaccine are you expecting initially, and how will those initial vaccines be prioritized and distributed, including the more rural parts of the province?
Yeah, so we've been working on this for quite some time. I don't have the exact numbers today. I have a good idea of what we're looking at. We have been working on exactly where they'll go. Understand, though, the first vaccine that we'll be receiving is the Pfizer vaccine, which means it has to be kept at -80. So there are limited places that we have the equipment and the ability to do that. So we will be receiving small amounts to start with across the country, and we will be focusing on those most at risk. And for us in British Columbia, that is people, particularly healthcare workers who are working in long-term care and on the front lines in our health system, in emergency departments, ICU, medical departments. But we will be providing more detail about what we see rolling out, not just next week, but in the coming weeks and months, and where people may find themselves in the rollout of vaccine. So this is the beginning. We're putting all the details together, and later this week, we, with the Premier and Dr. Ross Brown, will be having a more detailed briefing for everybody, for the public and for you, and we'll have a lot more details by then. I will tell you as well that we're participating this week, starting as part of it has started already, but starting tomorrow as well in a trial run of receiving the really specialized containers that come from Pfizer. They won't have vaccine in them at this point, but they will have the dry ice, and we'll be going through all of the procedures that are needed to safely handle these very fragile vaccines. So it's exciting. We are expecting that Health Canada will hopefully come out with what we call a notice of compliance in Canada, which is a license for the vaccine to be used, and we'll be ready to put immunization into people's arms as soon as we can. We are not going to have enough in the first few months that it's going to make a difference in community transmission. So that's why we all have to be continuing to follow our COVID safety plans. But we will be able to protect those people who are more likely to end up in hospital, who are more likely to die from this virus, and also to protect our health care system by ensuring that people who are at risk in our health care system are protected too. So that'll be the focus to start with, and that's why it's such a challenge for us now. But that light at the end of the tunnel is there. And we need to do our piece to keep our rates low so that we prevent people from dying until we have this protection for them here in our communities and across the province.
Next question's from Justine Hunter, Globe and Mail.
Thank you. I know BC is working on starting a pilot this week in long-term care with the rapid tests. I'm wondering how quickly you think you will be able to make a decision on whether this would be more widely adopted.
Yeah, so we've always said that we are looking for where the rapid test can play a role. It certainly will not be daily testing. That's not feasible or practical with the tests that we have. And as we know, they are not licensed for use for asymptomatic testing. So what we need to do is understand, one, if it's feasible, because one of the challenges we have in care homes is human resources and the stretched human resources, but also how does it fit into the screening that we do of people, of healthcare workers every time they come to work, and where does it play a role in helping us in that setting? We have, as I've reported on before, been using the rapid tests in other settings where we know it can be of benefit, particularly remote communities and in some of our shelters and our advanced surveillance in, for example, the downtown east side in Vancouver. And there's been challenges with the tests themselves. They don't actually work that well in the environment in the cold. So we're learning about where they might fit in. And yes, there's a number of long-term care homes in the Lower Mainland where we'll be starting to look at feasibility and whether they're of value in that setting.
Do you have a follow-up, Justine?
Yes, thank you. You said earlier today there was almost, I think, 1,700 active cases in long-term care homes. And I'm not sure, maybe you can clarify how many long-term care homes have new outbreaks. You said 6 facilities, but I'm not sure if those were all long-term care. But my question is, what does that say about what's wrong with the current screening protocols? Because clearly they're not enough.
Yeah, this is the question. We can't intuit where this virus is. And the screening, we are stepping up, of course, as everybody is. But we also have close to 60,000 people who work in long-term care. And everybody goes to work every day with the intent of doing their best to take care of people. And nobody intends to bring the virus in with them. It is so challenging this time of year when the virus is spreading so rapidly, and we're seeing that around the world and around the country. So yes, screening is a huge part of it, making sure that people are able to stay away if they're not feeling well, making sure we're able to test people rapidly, and we have a good response to that now. But despite our best efforts, yes, the virus does get in, and that's where we need to make sure that we're trying to detect it as quickly as possible, and it's becoming more and more challenging. And this time of year, we've seen this not just in care homes, but in other communal living settings, in farms, in workplaces, in the measures that we've put in place for gyms and settings where we could do things even a few weeks ago or months ago. The virus is transmitting very easily, and sometimes we don't recognize it. So we are looking at everything that we can do to try and protect care homes, and this is where vaccine is going to be so helpful, because we're able to protect those people who are working in care homes to start with, and residents themselves. And that is the focus of the first few months and weeks of the vaccine program.
Richard Zussman, Global News.
Dr. Henry, I'm sure you've seen again over the weekend, churches were open in some areas, and seemingly they are saying they are willing to keep accepting the fines to continue to operate. Has there been any consideration given to work with the public safety minister to increase fines for repeat offenders, or to increase those fines? And can you explain, have you provided any guidance, I guess, about fines for these anti-mask gatherings that are sort of guising as protests but could potentially lead to spread of the virus?
Yeah, so the short answer around do I provide guidance on the fines? No. That is within the purview of the Public Safety Ministry, and they look at other factors as well. It is a challenge, and I know there are many faith groups there are a few faith groups that are continuing to meet, and that concerns me. It concerns me because it is a misunderstanding of why we're trying to put these restrictions in place. And these restrictions are about recognizing there are situations where this virus is spreading very rapidly. And we have seen when we come together and congregate indoors in particular, those are settings where the virus is transmitted despite our best efforts, despite the measures that we have had in place for several months that were working for many months. We are now seeing that those are not enough right now. But I want to turn it around and talk about the vast majority of churches, synagogues, gurdwaras, temples, who have taken this to heart and are doing everything they can to protect their congregants, to make sure that people have access to the supports they need through it's going to be more and more important as we go through these important holiday periods, to support people to be able to safely practice their faith. And we see more and more of that. We have had the privilege of meeting with faith leaders around the province, talking to them about this. And we look at global leaders around the world who have been giving this same message. This is a global pandemic. It means that we have to do whatever we need to do to keep our members of our congregation safe, members of our communities safe. And right now, we are at a very challenging and risky time. And this is the time where we all have to take a step back and look at how we can support each other in a way that doesn't put people at risk.
Richard,
the mask demonstrators, there's small numbers of people, and yes, it does increase one's outrage factor, especially when I know there are people who are working day and night in our healthcare system, caring for people with COVID, making sure that people are still getting their surgeries. It really, in some ways, is a slap in the face. And we also need, however, as I've said all along, to recognize that people have a right to peaceful demonstration, and that we, as long as it's outside and they're not putting others at risk, the risk of transmission of the virus is less. Although, as we know, this time of year, it is more dangerous than it was before. So I don't condone them, and I think the other thing we're seeing is that most people are, again, doing the right thing, recognizing that my wearing a mask protects the workers in the shop that I'm going to, and your wearing a mask protects everybody as well.
Richard, do you have a follow-up?
I do, and this is for a colleague in our sports department. He mentions the BC Hockey League has been holding practices. They haven't seen an outbreak or a transmitted case of the virus. He's wondering if you can provide the rationale behind basically shutting down the league, because a majority of the players, or 48% of the players, are 19 and 20-year-olds, so they no longer can participate in sport. So can you explain sort of is that an unintended consequence of the measure around adult sport, and can you explain sort of why to make that decision that could have impacts on these sort of leagues?
It was not unintended. It was a recognized risk, and we talked with Via Sport, we talked with the leagues, and really it is about the fact that these leagues travel, that we're seeing transmission, and we're seeing transmission in the U.S. and other sports teams as well. So we have been seeing transmission events happening, and right now it's just too risky. We don't want people traveling to interprovincially. We don't want people traveling to different communities. And so, yes, the intent was to reduce that risk right now and to have an extended break for the teams. And I know in many cases, I've heard in discussions with the league as well, it's about young people returning to their home communities and having a time with their families during this period. We know that around the country and around the globe, the competitive leagues have had a challenge this year, and everybody is having these challenges. So it is an unfortunate thing in some ways, but it's also the most important thing that we can do right now to make sure that we're protecting youth for the future.
We have time for one more question. For everyone listening today, Dr. Henry and Minister Dix will release a statement this afternoon with the latest information on cases, hospitalizations, and outbreaks, which you can find at news.gov.bc.ca. For updated information about the province's restrictions, visit gov.bc.ca/regional restrictions. And for information about the province's new orders and pandemic supports, visit gov.bc.ca/COVID-19. Last question is from Marc-Antoine Boulanger, CBC Radio Canada.
Hi, Dr. Henry. Can you elaborate a bit on why you decided to extend the orders all the way until January 8th, rather than just going ahead into another 2-week chunk? Were you perhaps concerned about people that would make Christmas plans? And maybe people that were also hoping the restrictions would be lifted, and that, so maybe you can comment on that and just maybe explain the rationale behind that timeline.
Sure. Yes, it was partly that. So I've had a lot of discussions over the last 10 days, but particularly over the last few days with a number of my colleagues in particular in public health, but across a number of different sectors. And really looking at where we've been with our curve, what is happening, where we're seeing transmission still, on the upswing, and understanding where the transmission events are happening. We recognize that we are seeing an impact of the orders, but it's not yet at a point where we can let off on some of the restrictions that we have in place. And very much, the next incubation period would take us to just a few days before the Christmas holiday. Hanukkah starts this week, so there are important events that are happening, and we want people to recognize that this is something we're going to need to stick with until into the new year. So yes, it was to signal that this is not the time to plan large family gatherings, whether it's for Christmas or New Year's or other holidays through this next period of time, and that we're looking as well at when vaccine is coming, when we would hope to see a decrease in cases, and we cannot afford, when we're this close to being able to protect people, to have a surge of cases early in the new year that would again test and strain our healthcare system and put people at risk, and people getting sick and dying from this virus. So this is what we need to do now to get us through this most critical period. This will save lives, and that's what we need to focus on for the next few weeks. And did you want to answer in French?
Yeah, I'd like to do a supplementary question.
Oh.
Okay. So as a follow-up question, do you? I mean, we can suppose some people are already doing it, kind of gathering it, even if it's banned. So, how confident you are that maybe the public health orders right now could be enforced during Christmas time, is making it a bit awkward to show up at doors and say, hey, you're not allowed to gather. And then if we can get Minister Dix to just outline the new orders in French, please.
Yeah, so the intent of the orders, as we've talked about for the last few weeks, is to reduce those social gatherings, because we know that's where the virus has been transmitted. And the vast majority of people understand that, and it makes it very clear. It means that I can say without qualms, no, I'm sorry, I can't come. There are some people that don't understand it. I think about people in my life who maybe don't quite get it. So it is partly about making it okay to not have people over this year, to say let's try something different, let's try to support each other in a way that doesn't have those expectations of us having to come together, or us not having, but us coming together in a way that could put people at risk. So yes, you can say no to the party this year. You must say no to the party. You can say no to traveling, say no to having gatherings with people outside your household. And that is really important. And yes, we have had people fined who have had parties who've disobeyed this, but that is a deterrent that is only there to make sure that when people are being egregious, we have a way to address it. Because I think the vast majority of people in British Columbia who I hear from, who I talk to, understand that this is a most challenging and year that we've ever experienced, at least in my lifetime, and hopefully will ever be in my lifetime, and that we have to adapt, we have to be resilient, and we have to support each other with compassion, especially now.
Oui, juste pour dire que je pense que cette décision a la grande mérite de la clarté, n'est-ce pas, d'aller d'ici jusqu'au 8 janvier fait beaucoup de sens. Il n'y a pas de question sur le 21 décembre ou quelque date que ce soit, et que des gens peuvent se préparer pour les célébrations de la nouvelle année, les célébrations de Noël et d'autres grands événements du décembre et de janvier jusqu'au 6 janvier et après tout jusqu'au 8 janvier. Je pense que c'est la bonne décision. On a dit très clairement que ce n'est pas le moment de lâcher sur ces grandes questions. Il faut agir, il faut suivre les conseils du Dr Henry, de la santé publique et les autres aussi pendant cette période. Et je pense que des gens dans leur grande majorité, sont prêts à le faire. Ça va être une Noël différente qu'avant, une Noël qui va être quand même, j'espère, une célébration pour des gens, mais il faut nous protéger actuellement comme communauté. Et ces mesures vont nous aider à le faire. C'est la bonne décision, c'est la bonne voie. Et je pense que si on continue à suivre cette voie, cela va aider beaucoup de gens et ça va sauver beaucoup de vies. Merci beaucoup. Thank you very much. I will see you soon.